Okay, great. So why don't we start by, please tell me a little bit about yourself and the Seattle Jobs Initiative.
Sure. So I am the still relatively new executive director of Seattle Jobs Initiative. I joined the organization in January of 2020, and a global pandemic was not part of my 90-day plan. But we have been rapidly responding, as with most organizations, to a really changing environment, particularly since here in King County, at best estimates, over 300,000 people at some point have been impacted by job losses. And we're still trying to really quantify that impact. And we know that those that have been impacted are disproportionately from communities of color, is disproportionately impacted young workers, and is disproportionately impacted women. So we are really focused now, starting to pivot towards the recovery. What does that look like? So at SGI, we do a couple things. First, we work with a network of really grassroots community-based organizations, and we provide career navigation and support services for those organizations to ensure that people from those communities most impacted can get access to skills training and get back into the workforce. Second, we work at the systems level with many partners around, including the Seattle Office of Economic Development, the Seattle King County Workforce Development Council, organizations like 1199 Training Fund, to be able to build new systems that can be able to, again, connect to those communities most impacted and drive an inclusive recovery. We also have a policy and research shop where we look towards what the future of work is actually going to be, so that we can actually start designing policies and systems that can drive those responses in the workforce world. And then finally, we have a national consulting arm, and we're most known for our work around helping states and other municipalities be able to implement a complex federal program called SNAP Employment and Training. So we actually have consultants that are working at the national level, as well as around, I think we're in 9 different states right now, and more to come as people try to implement that program. So we're a small and mighty organization, but deep with expertise. And really, I would say the key linchpin of that is partnering for equity, so that we can have a workforce system that really works for all of us.
That's great. That's really exciting work. And we're here today to talk about your work with the Training Fund and the Health Care Apprenticeship Consortium. So why don't we start by talking a little bit about the medical assistance program that
Sure.
we've worked on. And
Mhm.
so can you tell me a little bit, what is the supply and demand like for medical assistance, and what are the barriers to retention?
Yeah. So the pre-COVID, there was a shortage of medical assistants. So the demand for medical assistance had begun to scale, and that was really driven by a couple of things. One, just the growth that we've had here in Seattle, King County, right? We're one of the fastest growing areas in the country pre-COVID. Number two, we actually have some pretty good access to healthcare here in Washington State. So we have a vibrant public exchange, so more people being able to access healthcare services. Again, a great thing. And then organizations really looking at how to better use medical assistance in the provision of care. So that demand was really driving, and supply hadn't really caught up yet. COVID hits. And if you look at the labor market data, you're like, oh my goodness, demand for medical assistance is plummeting. But really, what that was that as the crisis hit, healthcare organizations had to close down non-essential services. So things like elective surgeries or certain clinics were being closed down as we were trying to get our heads around how to respond to COVID. So that was really, really temporary. So we saw a drop, but now the labor market data shows that almost all of those medical assistants that were furloughed have been brought back. They may be in a different part of their organization, but folks are getting called back. And so demand still remains really, really robust. Our research indicates there's a couple things that are barriers to retention. So number one is that pay for medical assistance has lagged behind that of other allied health providers. So if you do a comparison about how much, not necessarily a dollar for dollar, but on a comparison basis, a physical therapist assistant or a pharmacy technician or essential supply technician has seen their salary grow at a higher rate than medical assistants have over about the last 5 or 6 years. Number two, because of the shortage, it makes for a little more stressful working environment. I think we've all been in places when if you're shorthanded and everyone's picking up the slack, you can do that for a short amount of time. But over the long haul, that becomes a really, really challenging endeavor. So in some ways, the fact that the supply has not caught up with the demand is then exacerbating and creating a bit of a negative cycle with retention. And then I think finally the some of the change, it really depends. The culture element, really can't be understated as well. There are some workplaces and employers that are great, and people find a great mix where their particular alignment to healthcare and where their passions and where their careers can be developed. But yet there are others where maybe an individual may not find that they really stick or where they belong to. So I think as this field of practice continues to expand and continues to professionalize, I think this is just part of the growing pain. So that hopefully, and that's one of the things that we showed that apprenticeship actually can help address is some of those cultural constraints or cultural differences.
That's great. That makes sense. And so you mentioned apprenticeship and how that can
Mhm.
help. And
Yeah.
what are the benefits of apprenticeship for employers?
Yeah, so when we looked at the data, there's a couple of benefits that really stood out. So one is retention. So that retention, those retention issues, because somebody, for lack of a better word, grows up in your organization, you really have that opportunity to build over the year of that apprenticeship through mentorship, through different experiences throughout the organization where people can really find that place. A typical apprentice might connect with different in different clinical settings, so they can find a place that, oh my goodness, this clinic out in Issaquah is that these are my people. This is where I really belong, right? So that retention is really important. The other thing we found too is that the people that work for the organization already that got to serve as mentors, so those existing medical apprentices, found huge value in that work. All of us really want to advance in our careers or do different things. The opportunity to share and the opportunity to teach others and to feel like you're passing on to the next generation is a really important value add that is there. So those are really, I think, two components that really jumped out to the top. And then we can really kind of attach some actual ROI to that in terms of retention and churn are key drivers of financial performance. I think another thing that we're still struggling to quantify on the financial side, but is really important, is that apprenticeship allows employers to recruit a much more diverse workforce. So actually having representation at their skilled provider level from communities that they're providing health services for. And so we're still working through some of those about how we can actually quantify that from an accounting standpoint. But I think we can all agree that from a mission standpoint, from a value standpoint, that aligns with many of our healthcare providers.
Yeah, definitely. That's fantastic. And so how do you calculate the return on investment for
Mhm.
employers for apprenticeship?
Yeah. So the work that we did really tried to look at what the costs were and then what the benefits. So there are costs to doing apprenticeship. And what we did is we did a comparison between a healthcare provider that would hire an apprentice on day one versus hiring someone that already went through 2 years of school at one of our amazing community and technical colleges. And so clearly starting with somebody on day one is they're not going to be able to provide as much value right out of the gate. Right. So there's some cost for training, whether it's formal academic training, there's cost of the mentoring. You've got to have a coordinator, right, to be able to coordinate all those things to ensure that the experience is really meeting those high standards for medical professionals that medical assistants truly are. So there are definitely some upfront costs. And if you just look at year one, if you hired one medical apprentice that came out of community college and one that came out that's starting as an apprentice, the medical assistant with 2 years of academic experience is going to provide a greater value the first year. But by year three, those tables turn. And that's because then we start to look at the benefit side. And so when we look at retention is the largest driver of that. So we talked about already how that apprenticeship component can really help somebody find their place within a larger organization. They're really kind of growing up and learning within your particular organization's culture, aligning with its values and mission. And so that the retention numbers are the largest driver of that benefit. Um, I think it's important to note too that an apprentice, while they may be start a little bit behind that first year, the person who went through the medical assistant program, they are still providing value. So they're still going to be seeing patients as they move through their apprenticeship and they get through that. So they're actually going to be providing service and generating revenue for organizations. So it's not like you're taking somebody for a whole year that provides no value. It just is a little bit of a different slope or a little bit of a different turn over time.
Yeah, that makes sense. Thank you. Can you tell me a little bit more about how apprenticeship is a model for creating an equitable talent pipeline?
Yeah. So I think the biggest thing is that if somebody wants to become a medical assistant, they want to go to our community colleges. And again, we have amazing community and technical colleges here in Washington State. We have a really robust system, but you have to pay for it. And even if you can pay for the tuition and the cost of attendance and a laptop and all those things that go with obtaining a higher education credential, you still have to provide for basic needs. Most people have to pay rent and we have to buy food and we have to pay for car insurance and all those different things. And so having to upfront those costs really excludes large swaths of our communities from being able to access that. And it's not to say that our colleges don't try and are not working to really try to close some of those equity gaps to make higher education affordable. But there are still people that just look at that cost or look at that price tag and say, I can't do that. And so apprenticeship then says, well, I'm going to start earning a paycheck starting on day one. I'm going to be employed. I'm going to have access to benefits. And so it takes a whole groups of people that feel that higher education is unattainable, and it closes that aspiration gap. And then number two, even if somebody started in that community college program and all of a sudden perhaps they're from a lower income family and something happens, people have to drop out, people have to take a pause, and colleges work to try to fill those gaps as best that they can, but sometimes it just becomes too much for people. Whereas an apprenticeship program, you're fully benefited, you have access to all of those different supports that you would as a full-time employee, which can often help people be able to get through that. So the persistence component is really, I think is a really important part to be able to do that. So really opening the doors, keeping people through that, and the data reflect that. Medical assistants that come through apprenticeship are far more diverse and representative of the communities that live here in Seattle King County than those that go through our community college programs.
Wow, that's great. Thank you so much. Is there anything else that we haven't talked about that you'd like to share?
I think the last thing I would say is that I think there's more work to do in being able to provide opportunities for some of our smaller employer partners, because if you're a community clinic or you're an organization that is really hyper focused in a particular area, the administrative requirements of doing the apprenticeship and just all the structural things you have to do continues to be a challenge. So I think we need to continue to, as we learn from particularly working with some of our larger providers, what can we learn? What efficiencies can we drive down to those smaller employers to be able to ensure that this is a mechanism by which they can get a diverse, equitable, but yet a highly trained and highly competent workforce?
Definitely. Yeah, and I know that the Healthcare Apprenticeship Consortium is, trying to work with employers and make that as easy for them as possible. And we're also
Yeah,
working with smaller ones. So yeah, I agree. We're working on that and there's more to be done.
absolutely.
Great. Well, thank you so much for taking the time today. This was very helpful. I really appreciate it.
All right. Thank you, Tyler. Have a wonderful day.
Thanks, you too.